Hi, my name is Stephanie Martinez. I'm a senior nursing student at Cedar Cross College, and this is my Nursing 335 summary reflection video. The purpose of this video is to explain how I met the 8 clinical objectives for leadership this spring semester. Objective number 1 is to utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I felt I achieved this objective in 2 separate ways. First, I attended a blood pressure clinic at Rodeo Aquatic Center. I was able to use my clinical skills of taking manual blood pressures to screen whoever sat down to have their blood pressure checked. As they sat down, I was able to answer questions they had regarding whether or not it was in the normal range. And when they had any concerns, I was able to provide them some basic knowledge about like hypertension, heart disease, and diabetes, and how that impacted their blood pressure. I also used my previous knowledge during peer leadership. I was with a 313 clinical group and a 321 clinical group. In the 313 clinical group, I was able to sit with the students and help them with their videotaping scripts. I was able to sit there and run through their script before they went to videotaping for the day. I was able to answer any concerns or questions they had because they're still relatively new to videotaping at that point in the nursing program. For the 321 students, I mainly assisted them with MedPass. I helped them organize their meds and ran through some sample questions of knowledge that I knew Professor Seaman would expect them to have. Objective number 2 is to apply the basic principles of ethics and management to meet the challenge of an ever-changing healthcare environment. I felt I was able to meet this objective in 2 separate experiences again. The first was during patient logistics. Although these ladies weren't practicing at the bedside anymore, they were utilizing their previous knowledge and clinical experience to best place incoming patients on the proper unit at the best bed where they could obtain the best care that they needed. I also saw this when I had an evening with the nurse supervisor, Sue Long, over at LVHN's Muhlenberg campus. She handled staffing for the entire hospital, and I felt that she did this effectively by using shared leadership. She would go floor to floor and work alongside the charge nurse to formulate a plan for staffing for the shift. And I saw that she really valued the relationships with the staff, such as the nurses and the technical partners, because she knew almost everybody by name. She told me that she was familiar with who would be willing to pick up overtime, who would always be willing to come in to help. So that proved to be useful that evening because she was quite short-staffed in a number of units. So she was able to provide that information to the charge nurses to place a call to those specific employees to see if they could come in to help out for the night. She even had to call over to the Cedar Cross campus to get a critical care nurse float over to help in the ICU because they were very understaffed that night. So she was able to handle that despite all those challenges that evening. And that reminds me, the patient logistics ladies were also able to effectively handle the ever-changing healthcare scene because, as we know, patients are always being admitted and discharged to the hospital. So they would take all of that into account when placing patients on specific beds. Objective number 3 is to demonstrate leadership skills through the effective use of communication by representing self, the college, and nursing in a professional manner. I felt that I achieved this at Capitol Hill Day. I had the opportunity to meet with an employee of the Representative Mario Scavello. I discussed some legislation with her and explained why it was was important to me as a senior nursing student, future nurse. And I also maintained professional communication when I wrote my thank you letters to all the nurse leaders that I was able to have experiences with. Objective number 4 is to critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare systems. To meet this objective, I found an article which is titled "The Nexus of Nursing Leadership and a Culture of Safer Patient Care." I will also be sharing this article during post-conference in greater detail. The gist of the article is it's discussing 2 recent reports which indicate that the healthcare organizations, including nursing leadership, are remiss or inconsistent in fostering a culture of safety. The factors needed to promote a culture of safety include supportive leadership, effective communication, orientation, program ongoing training, appropriate staffing, and compliance to policy and procedures. Since nurses have the highest interaction with patients, nurse leaders are at the forefront to influencing organizational culture to safer practices. The overall take home is that effective leadership is essential in engaging the staff to provide the highest quality of care to promote the best possible outcomes for patients. Objective number 5 is to function as a competent patient advocate, nurse advocate, and change agent. Again, I felt I accomplished this at Capitol Hill Day. I was able to see how being a nurse advocate is crucial for my career as a nurse, as well as everybody who went with me that day, my peers and their careers. We as nurses are the largest part of the healthcare workforce, but only one former nurse sits on the government in Harrisburg, so we are very underrepresented. I think it's very important that the state of Pennsylvania makes the effort to work together. We have quite a number of nursing schools and quite a number of nurse employees in the state. I feel that if we work together, we could probably make a bigger difference. If we do not ever come together to make ourselves heard, then nothing will ever change. I also felt that I served as a patient advocate during Meals on Wheels and my service hours at Daybreak. During Meals on Wheels, I was able to ride along with 2 volunteers to deliver meals to some elderly clients. I was able to provide a tiny bit of social interaction with them when I took their food to their door, which is something that the elderly population is often lacking. They're often isolated and lonely, and they don't have resources to adequate a meal. So the work that Meals on Wheels does is very important. At Daybreak, they also provide breakfast, lunch, and dinner to adult clients who come into the drop-in adult center. I was also able to act as a patient advocate by participating and facilitating groups such as arts and crafts and coping skills. So I felt that I was helping that specific patient population by teaching them the skills they needed to improve their social interactions. Objective number 6 is to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. I achieved this throughout my continuing education experiences. My experiences included 2 SNA Dine and Discusses and the National Student Nurses Association annual conference in Nashville, Tennessee. Some of the major take-homes from the SNA Dine and Discusses were to just be a patient advocate, whether it be for one patient population. One of the Dine and Discusses was about autism and just learning the proper symptoms to be able to educate the general public on what autism is and what it is not, the treatments available, and how you diagnose autism. The other Dine and Discuss was pertaining to the healthcare deficits in the population of the LGBTQ population. Um, uh, so in that Dine and Discuss, we learned how healthcare providers often don't know how to interact with that population. And they're awkward and they don't know which pronouns to use. And it's just all a matter of basics. You take it back to your basics and you simply ask the patient and you listen to what they're telling you and you respect what they're telling you. You always provide non-judgmental care and non-biased opinion when interacting with them. In Nashville, some of the major take-homes were that we as nurses are lifelong learners. We must keep learning in order to be taken seriously and to even sit at the table when discussing patient care. Another big takeaway from Nashville was that we should all be professionally involved in our respective organizations, whether it be at the state level or at our specialty level. And regarding our specialty, we should all pursue certifications to make yourself always providing the most up-to-date information and just having that extra certification stating that you are providing the best care that you can to your patients in your specialty. Another takeaway from Nashville was that we as nurses have the power to be innovators and barrier breakers. We should do everything in our power to continue to do that. Objective number 7 is to recognize the role of the nurse in policymaking related to healthcare services at the local, state, national, and global levels. Once again, I achieved this through Capitol Hill Day. We had the opportunity to research a bill and share our opinions with a representative of Representative Mario Scavello. I met with his employee and I discussed with her several bills regarding delegation, staffing considered the acuity of the patient, and nurse practitioners obtaining a full practice authority. These bills are important to me. Delegation is important because we're taught it as a part of our curriculum and it's on our NCLEX. We have to know delegation to become a nurse. However, according to our Nurse Practice Act, delegation is not legal. So I explained to the representative that I was not comfortable with the way things were. The legislation is obviously out of date and delegation is done every day in the healthcare environment. However, the legislation just hasn't caught up, so I urged her to urge Mario Scavello to support this bill. I also discussed staffing, considering the acuity of the patient. There's 2 major bills in the House right now about staffing. One is just mandated nurse to patient ratios, not considering any of the factors that do come into play, such as acuity. The other one does consider acuity. I made it known that I supported the bill which considered acuity because the acuity of a patient could change everything. One patient could tie up 2 nurses for 8 hours, and it's just not fair when there's mandated ratios that's not even considered when the reality is different patients require different care. And I also talked about the nurse practitioners being able to fully practice in the state of Pennsylvania. That's important to me because hopefully one day I will go back for my master's to become a nurse practitioner. I'm not entirely sure which specialty yet, but right now that is the goal plan for me. Objective number 8 is to predict and describe potential ethical dilemmas within the clinical, organizational, and professional nursing practice. Once again, I think I was able to see this to meet this objective during patient logistics. When I was sitting alongside the lady who handled expired patients, she explained to me how important it is to have all the proper documentation in line and how to ask all the right questions when the funeral homes start calling because they all want to get that business. Unfortunately, it's all about the money. So she just explained how important it is to have all your ducks in a row when dealing with that type of situation, to make sure that that body goes to the right place and that that body is released to the appropriate people, whether that be the family, the coroner, or the funeral home. And that is a brief synopsis of how I felt I met my objectives this semester. Thank you for watching. Have a great day.